At this year's ASCO GI meeting, we're shining light at a very important problem that we encounter in our clinics, which is the rise in incidence of early onset esophageal and gastric cancers. As a tertiary cancer center, we see many of these patients, and we've established now a young onset gastrointestinal tumor program to help support these patients through this difficult time. So at this year's meeting, Dr. Lumish, one of my colleagues, is presenting data on clinical and molecular characteristics of early onset versus average onset esophageal and gastric cancer. And this is a unique cohort of patients where we did both germline and in-depth somatic analysis of these tumors. And what we found is that what's interesting that some of the alterations that are occurring in late or average onset gastric cancer is also seen in early onset. So biologically, it does not appear to be a distinct disease in esophageal and GE junction tumors. But in distal gastric cancers, these appear to be more related to CDH1 alterations, both in germline and in somatic alterations. What we find that early onset gastric cancer has a higher proportion of gastric tumors than average onset and has more signet-ring cell histology. The early onset patients tend to present later at in their course of their disease because often their tumors go underdiagnosed. If you're a young patient presenting to a doctor with vague symptoms, the clinicians often don't think that it's cancer and pursue other diagnoses before the cancer is diagnosed. And so this prolonged time from symptom onset to diagnosis is something that is important and needs to be addressed, and both from the patient perspective, patient education perspective, but also general practice perspective. Again, a lot to learn about this disease, and that's what we're doing at our center. We're really promoting the early onset program to allow specialized care and support, fertility, social support for these patients that makes a big difference in their care.